Welcome. My name is Amy Abelar, and I am an acupuncture and integrative medicine doctor and a holistic PCOS specialist. This video is going to cover how to get a diagnosis of PCOS. The most commonly used diagnostic criteria is the Rotterdam criteria, which requires two of the following three findings: hyperandrogenism, ovulatory dysfunction, which creates irregular menstrual cycles, and polycystic ovaries. And of course, we also need to rule out other causes of hyperandrogenism and ovulatory dysfunction. Unfortunately, receiving an official diagnosis of PCOS from your Western doctor can be a very difficult road for patients. There was an international study of almost 1,400 women that was done, 1,400 women with PCOS, and that revealed that getting a firm diagnosis often took over 2 years and required multiple visits with three or more health professionals. In another study, almost one-third of reproductive endocrinologists and two-thirds of OBGYNs could not actually identify the Rotterdam criteria for diagnosing PCOS. This study also found that few of these medical providers were even aware of the associated health conditions to screen for, like diabetes, high cholesterol, high blood pressure, and obesity. So if you're interested in learning more about the other health conditions that women with PCOS are at risk for, you can check out our other videos on that topic. So, as I mentioned, you need at least 2 out of 3 of these criteria in order to receive a PCOS diagnosis. Because of that, there are 4 different phenotypes or subtypes of PCOS. So, in this spreadsheet here, you can see that the type A or classic complete or classic PCOS has all 3: polycystic ovaries, hyperandrogenism symptoms, as well as labs, and then the irregular cycles. But there's also type B that just has hyperandrogenism and irregular cycles with no polycystic ovaries. And then type C has 2 out of 3, type D has 2 out of 3 as well. So as you can see, some of the time what can happen is providers may do an ultrasound of the ovaries to see if there are cysts. And if there's no cysts, they may rule out that you don't have PCOS and move on. But as you can see, phenotype B, for example, has hyperandrogenism and irregular cycles, but no cysts on the ovaries, and this person still has PCOS. Each of these phenotypes are problematic for women's health, and they need to be properly managed. So if you are interested in learning more about testing for PCOS and holistic treatment options, you can subscribe to our channel and visit our website for more PCOS content or watch other videos on our YouTube. Thank you so much.